Welcome. My name is Daniel Haters, and I'm the Managing Director of Digital Health at Nex Cubed. Today, we're welcoming all of you to our 2020 Digital Health Showcase and Demo Day. This is one hell of a time to be alive. Unfortunately, nearly 225,000 of our fellow Americans have lost their lives due to the COVID-19 pandemic. But it's even worse than that. Globally, our economy is in ruin. And on top of that, we live in the midst of maybe the greatest and largest civil rights movement in our country's history. To put it in perspective, the human take of COVID-19 is that this is the worst global healthcare crisis in at least 40 years since HIV/AIDS global pandemic swept the world, but more appropriately, maybe 100 years since the Spanish flu. The social take of COVID-19 is that this is the greatest U.S. civil rights movement in at least 50 years from the Civil Rights and Voting Rights Acts when they were passed. And the financial take, as I was mentioning before, this is the worst economic crisis in at least 10 years since the Great Recession, but more appropriately, probably 90 years since the Great Depression. But the digital health take is very different. Today represents the greatest population health opportunity in at least 160 years since the advent of clean drinking water, or more appropriately, potentially 220 years since the smallpox vaccine was invented. COVID has allowed others to see what we in the world of digital health startups already knew. And what we know is the great Walter Cronkite once said, America's healthcare system is neither healthy, caring, nor a system. Our healthcare system is in crisis, and it didn't just happen because of COVID. 80% of Americans report on holding off on preventative care. 9 out of 10 parents are holding off on their own care so they can provide health care to their children. And it's even worse if you're a woman. The maternal death rate has more than doubled since the late 80s, and is not just due to socioeconomic factors. White suburban women are affected just like black women and other minority women. The numbers are less staggering in terms of absolute, but on a percentage basis, all women are suffering in our country. And then we have the growing surge of folks turning 65. The percentage of people globally, 65 and over, is expected to double between now and 2050. And in the US alone, our spend as a percentage of our GDP for healthcare has gone from 5% in the 1960s all the way to 20% today. This is unsustainable. So where are we spending our money? Although the pharmaceutical sector quite often gets much of the blame for wasted dollars, pharmaceuticals only represent about 10% of our $3.5 trillion plus US healthcare spend per year. 50% of that $3.5 trillion is spent on physician services and hospital services. Together with pharmaceuticals, that makes up 60% of the spend. We have to solve those issues. But we cannot solve these issues with more people, more hospitals, and more laboratories. So what do we do now? Great crises create great opportunity. The digital health revolution has begun. This revolution is based on the idea that for the first time since the advent of clean water and vaccines that I was speaking about before, we have the opportunity to reduce cost, improve outcomes, and change the social determinants of health all at the same time because of data. Data is the new currency of healthcare. Data places the patient at the center of healthcare. Data allows healthcare to always be on, for patients to always have access to their physicians, for them always to be under the care of folks who care about them, both personally and their family, and their doctors, which in this world may be hundreds or even thousands of miles away. But how do we really know that digital health is the future of healthcare? Well, the markets are voting with their wallets. For instance, in the public markets, we've seen recently the Teladoc-Livongo merger, or most people know it colloquially, the Teledango merger. In this case, we saw 2 digital health care companies who were once worth hundreds of millions of dollars or tens of millions of dollars go through a merger and acquisition, valuing the new company at tens of billions of dollars. But it's not just there. The venture capital markets in digital healthcare are on fire. Through the first half of this year, digital healthcare firms have raised almost $5.5 billion in venture capital dollars. This is almost equal to the entire venture capital haul for digital healthcare companies in all of 2017 and outpaces by over $1 billion the fastest pace to previously occur. So what are we here to do today? Well, today we're very proud to present to you 5 companies that we've recently invested in and accelerated. And to describe a lot more about what we do here at Nex Cubed Digital Healthcare and these companies in specifics, I'm happy to turn this over to Nick Phillips, our Program Director for Digital Health at Nex Cubed.
Thank you very much, Daniel. That was a great State of the Union for the digital health space. Now, Nex Cubed has been doing this before it was cool or on trend to do. Our 28 portfolio companies in our digital health portfolio have an estimated enterprise value of over $175 million. That's a lot for not a lot of companies. In 2019 alone, Nex Cubed Digital Health invested $3 million across 16 companies, making us one of the most active digital health investors in the country. And not only that, those companies have raised over $40 million to themselves. Our current portfolio that you're here to learn about today is very, very important for us. It's very groundbreaking on a couple different fronts. They've raised the most money prior to coming into this cohort than any of our other cohorts in past, to the tune of nearly $10 million. Not only that, but more specifically, this is our most diverse group of founders that we've had to date. This is something that is very important for Nex Cubed. One of our mandates is that we invest in over 50% of our companies that are either female or minority led. This cohort that you're going to see here today matches all of that and more. They're all either female, minority, immigrant, or different diverse founders. They don't look like me, and that's for a reason. We believe that Nex Cubed in the next wave of businesses is not only just a diversity of people, but it's diversity of minds. And this is where we believe that the true future of healthcare and other industries are going to be. So we are proud to make these types of investments. What are we going to investing in today? What are you going to see? We're going to see things from digital therapeutics, getting back to travel safely in this COVID climate, the virtualization of care, mental and behavioral space, our mental and behavioral health, and senior care. We're really, really excited about what we have to show you. And again, we're doubling down on the themes that Daniel mentioned in the previous segment. All right, Nick, now enough of your talking. We're here to see the companies, and I'm right there with you. So how do we do this? Well, step one, you're already on the YouTube Premiere link. We're about to see these 5 great companies showcase their businesses and really have a chance to learn more about them. But not only that, right after this, we're going to transition to a live Zoom webinar where we're going to be able to have a fireside chat with those exact same founders and hear from them more about some of the pressing questions that you may have burning in the back of your mind. So join us now. We're excited to have you here. Thank you very much for spending your day with us. We're excited to kick it off with Renee Health. Renee Health is getting people back to travel safely in this COVID environment. We're really proud to present them. Take it away, Attilio.
Hi everyone, my name is Attilio and I'm the CEO and founder of Renee. A few years ago, I had an accident while I was traveling that left me with a $12,000 bill that my insurance company didn't cover. You see, the insurance that you're getting from your credit card or even your employer's insurance is not enough to cover the needs of the modern traveler. And if you're a business, you're liable for whatever happened to your employees while they're abroad. And what's worse is that small and medium businesses are failing to comply with duty of care regulations, exposing themselves to hefty lawsuits and leaving employees unprotected. In order to address this, we created Renee, a platform that helps the world get back to safe travels by using an algorithm that matches the right type of insurance for every trip and gives user access to medical services around the world. Besides our algorithm and easy access to hospitals, Renee has everything to keep you safe and healthy, providing safety information, travel advisories, and even COVID-19 updates, making it the perfect tool to comply with duty of care requirements. Our dashboards allows HR or travel managers to control how Renee is implemented, setting up trips, purchasing insurance, and even creating travel policies for the entire organization. Last year, we worked really hard to be able to offer policies from the biggest insurance companies in the world, and we partnered up with Teladoc to offer our customers access to telemedicine services around the globe. This may come as a surprise, but the travel insurance market, it's a $19 billion industry. And with over 233 million international trips every year, the market opportunity is huge. But instead of going after each customer individually, our model involves partnering up with agencies, travel management firms, and other providers who are already selling to our ideal customers. But Rene is more than insurance. Our platform allows companies to stay compliant with travel regulations in a modern way. Instead of paying exorbitant consulting fees, our customers pay a monthly subscription to access our travel intelligence tools. And then they pay for insurance only when they need it. The competition in this industry is very interesting. You have big players established for decades, offering a good insurance solution but very difficult to use and access. And then you have modern startups focusing on the final consumer, leaving the small and medium businesses that are responsible for over 65% of the total world travel without a solution that fits their needs. Rene's ability to bundle different types of services using state-of-the-art technology puts us in a unique position to address a very fragmented and outdated market. We launched in December last year, and we were almost tripling our sales every single month, making over $20,000 in MRR, but then COVID happened. And just like after 9/11, we believe that COVID will change how people travel forever. But for us, COVID worked as an accelerant that allowed us to double down on our efforts to make travel a safer, more caring experience for everyone. And the way that we're doing this is by adapting our solution to cover the needs of travelers who are now struggling to comply with these new regulations. We introduced a new dashboard with more customizations and added more resources to our travel intelligence platform. And we are proud to announce a partnership with a leading healthcare company to offer COVID-19 tests to all of our customers. In the first month of launching this new strategy, we signed up 10 companies who are projecting around 1,500 trips. That represents over $200,000 in revenue. And we forecast $1 million in sales over the next 12 months. To further validate this model, we are already talking to companies like IATA, JetBlue, American Airlines, and many more that are interested in creating pilots with Rene. This is the cornerstone of our strategy that will allow us to achieve our revenue projections. I started my first company when I was 17 years old, along with Gustavo, my current co-founder and CTO. We met 15 years ago in high school and worked together ever since. Besides our team, with whom we had the pleasure to work with for almost half of our lives, we recently brought Kevin Mitchell on board, a corporate travel leader with over 45 years of experience advising companies and governments. Kevin is not just an advisor to the board. He's so passionate about Rene that he will be the face of our campaign for our corporate customers. To sum it up, we found product market fit in an industry with huge potential. We position ourselves to succeed after a global pandemic. We create partnerships with key players in the industry, securing access to customers. We raise institutional money from well-known firms, and we're already making an impact on an industry that hasn't seen any significant change for over the past 20 years. In order to further develop our product and take advantage of the attention that we're getting due to the pandemic, we're raising a seed round of $750,000 from October the 1st to November 15, with 40% of the capital already committed from funds like Quake Capital and Nex Cubed. If you're interested in making travel safer, please come talk to us. Thank you very much.
Next up is Butterfly Health. Butterfly is a first-of-its-kind digital health platform created to change the lives and health of expensive, chronically underserved, chronically ignored, chronically misunderstood communities, built by founders that understand these communities because they are from these communities. Please welcome Butterfly CEO, Ariva Martin.
Hello, my name is Ariva Martin, and I am the founder and CEO of Butterfly Health. Together with my COO and co-founder, Rodney Bell, we are a brother-sister team. Overcoming obstacles and achieving success is what we're made of. We grew up with our grandmother Devan, surviving on welfare, food stamps, and Medicaid. We know firsthand what it's like to be denied access to high-quality medical care. We also know it doesn't have to be that way today. Our grandmother didn't have a lot of money, but she gave us a lot of sage advice, especially to whom much is given, much is expected. This background motivated Rodney and I to start Butterfly, the first of its kind digital behavior health platform focused on underserved and underrepresented Medicaid populations. I come to this work as a Harvard Law School graduate, a best-selling author, and a nonprofit leader. My work has connected me on a first-name basis with C-suite executives at major plans across the country, including Anthem Blue Cross, Blue Shield, LA Care, and Kaiser. 2020 is the year where we face a dual pandemic, the coronavirus and worldwide protests over social justice issues. These seismic events have caused a crushing wave of mental health problems, leading to a dramatic increase in the number of people seeking help for depression and anxiety. Today, we find more than 1 in 4 Americans struggling with mental health problems, and virtually all facing tremendous barriers to care. These barriers include our fragmented mental health system, profound stigma, shortage of providers, and limited access to quality mental health care. Together, they lead to chronic physical illnesses such as heart disease and respiratory issues. They also cause increases in emergency room visits, higher medication utilization, and an overall cost burden on the healthcare system. Mental health conditions account for almost half of the total Medicaid expenditure. This translates into $131 billion per year, making Medicaid the largest payer of mental health in the United States. Butterfly solves the problem of access and stigma while reducing the total cost of care. We provide a safe, private, evidence-based, racially and culturally competent behavior health program, which includes clinically validated assessments, wellness tools, and cognitive behavior therapy. We also provide 24-hour text-based coaching and individual teletherapy. The core component of Butterfly is our condition-specific peer-to-peer community forums. Butterfly uses images and content which respect and respond to diverse and varied mental health and wellness beliefs. Unlike previous digital health solutions, we mirror the communication styles, attitudes, and practices of our users in their daily lives. We already have 100 beta testers on the platform, and so far, the feedback has been tremendously positive. We have traction with 8 Medicaid health plans, including Kaiser, Anthem Blue Cross, and Partnership Health. We are looking to close on a paid 1,000-person phase rollout that will allow us to prove out adoption, retention, engagement, and efficacy. We have secured investments from startup health and angel investors. We also have features in Black Enterprise and Black Star News. Our business model is B2B2C. We generate revenue from our plan clients, ensuring that the Butterfly platform is free to end users. Our team consists of our COO, Rodney Bell, who's had 2 successful exits, a product developer who has built healthcare apps with the U.S. Veterans Administration, and a licensed clinical psychologist with a background in commercializing digital wellness programs. As Black founders, we understand the urgency of this moment. Our lived experiences, our expert tech team give us a unique opportunity to design and deliver a scalable solution that resonates with the huge Medicaid population. And as mentioned, we are partnered at the C level with the largest players today, all of whom have made a commitment to action. We have opened a $1 million seed round in order to build out our technology and infrastructure, enabling us to achieve full commercialization and reach our milestones, including 500,000 in revenue by Q4 2021. For those that can see solutions and not just problems, this is your opportunity. We are Butterfly, the right founders with the right solution at the right time. And this is your moment to lead in social impact investing and to prosper while innovating. Translation, in the words of the late iconic civil rights leader, Dorothy Height, this is your opportunity to organize your butterflies. Thank you.
Next up, we have Previ. Previ is the backbone that enables always-on, always-there care to be possible for patients around the globe. This team has built a unique platform that leverages interoperability with EMRs to provide a singular solution that extends the care outside of the four walls of the clinic. This international team has built successful products before, and we are thrilled to present them now.
Hi, my name is Sara Fernandez, and I am co-founder and CEO of Previ, where we enable providers to reach their patients wherever they are and empower patients to take control of their own care. It's great to be here. Recall your last medical visit. Most likely, you left the office with a piece of paper like this. If you are a patient with multiple conditions, you may be getting one of these papers from each doctor visit. And should you lose one of them, you're often left alone, struggling without guidance. COVID has exacerbated this problem. COVID has filled many hospitals, but it has empty clinics, and patients have lost touch with their doctors. Doctors are blind to what is happening to their patients, and many are struggling financially without seeing patients. Many doctors jump to telehealth, but are unhappy with current solutions. With Previ, doctors and patients' lives are about to improve dramatically. With Previ, virtual care not only expands, but receives a serious upgrade. This is what virtual care looked like until today. Multiple solutions, each for a specific service or a specific condition, and most of them didn't communicate with the EMR. There are three fundamental flaws with this scenario. One, the provider struggles using multiple platforms and having to navigate between them. Two, the patient also has to use multiple apps. And three, the data is siloed across multiple platforms that often don't communicate with each other, nor with the EMR. This is Previ, an all-in-one solution for virtual care. Because Previ integrates with major EMRs, it's easy to integrate into existing workflows. All the data related to a patient from the EMR, as well as external data from medical devices, fitness monitors, and data from surveys and assessments resides in a single place. This data aggregation enables high-performance analytics across a much wider scope of data than what is currently available today. A recent survey asked CIOs of major health systems what they were looking for in a solution like Previ, and they underscored the need to be integrated with EMR and current workflows. They wanted a simple solution that it was easy to use both for providers as well as for patients. They didn't want multiple solutions, and they wanted multi-language so they could reach all their patients. This is what Previ is offering today. I know, it sounds too good to be true until you meet Jose. Jose is a serial entrepreneur with more than 15 years of experience in digital health. In fact, Freddy is a culmination of more than 15 projects funded by the European Union, where he built different digital health solutions that were later deployed in health systems across Europe and Latin America. I bring more than 10 years of experience in the US healthcare market. I spent 8 years consulting for pharma on how they could expand patient access to their products and developing patient support programs. My last 3 years, I was working in corporate strategy, doing M&A, evaluating digital health solutions on how they could improve operations and finances at doctors' offices. We are both international founders with experience in the US, Europe, and Latin America. We are big believers on health systems that focus on prevention and care management and systems based on value, where the US is moving to. Our experience and heritage enables us to be close to the Hispanic population and develop care plans for them in Spanish. In fact, our initial customers are doctors in Florida, where the majority of their patients and all their staff speak Spanish. We have been working with them for over a year, and while it was a great way of testing Predi, we are now in conversations with 2 large health systems to do phase rollouts where we build case studies for further validation. Predi has been recognized by the Office of National Coordinator at HHS for its data aggregation capabilities and by Novartis as a premier patient engagement platform. We are free for patients and in a subscription-based model for providers. Our goal is to be the single virtual care solution that a provider uses to reach all their patients, and that means flexibility in pricing to accommodate different payer mix. We are operating in a large market that is growing rapidly. We have done a bottoms-up estimate of a total addressable market of $14 billion only considering the technology component of virtual care. And this is in line with external top-down estimates of the virtual care market. To date, we have raised $700,000. We are not raising currently, but we plan to start our next round in the next 6 months. So we want to start those connections today. We are excited by the many mission-driven healthcare investors in the audience. So please reach out to myself and Jose via email or visit predi.co if you want to learn more or if you have connections among health systems that may benefit with Predi. Thank you so much for your attention.
Next up is Litesprite. Litesprite is a digital therapeutic that is changing the lives of patients suffering from mental and behavioral health conditions. Litesprite is clinically validated, more engaging than the top consumer apps in the space, and recommended by the US Surgeon General. Please welcome Litesprite CEO Swati Surve.
We know video games captivate. Can they go one step further and improve health? I'm Swati, founder and CEO of Litesprite, and we build games to help people manage chronic health conditions. Clinicians and players rely on our data insights. With the pandemic, the number of people in the US suffering from a mental health issue has now doubled. A recent CDC survey found that 41% of adults are now suffering. This costs billions of dollars in lost productivity and direct costs. Our clinically validated mental health video game, Litesprite, is the first to win a US Surgeon General Award and the only one recommended by clinicians and payers today. Clinicians use our unique player-generated data to transform care through a deeper understanding of their patients. In a clinical setting, we have worked with a range of diagnoses. Litesprite is based on Bandura's social cognitive theory, a commonly accepted framework by clinicians. As a player-driven world exploration game, it is a safe place where people are empowered to explore their emotions, understand their triggers, discover what evidence-based techniques work for them, and learn those skills. Sox the Fox, the game's main character, is a peer that provides critical emotional support. Socks becomes a Zen master by teaching people proven techniques that reduce anxiety and depression. Players select from a range of mini games. Socks guides players through exercises including journaling, exploring emotions, meditation, and breathing. Suzette is a typical Litesprite player. She has several behavioral health and physical issues. As a caregiver to her adult autistic son and grandchild, her home life is very stressful. Over the past 2.5 years, whenever Suzette has had a crisis, she has trusted Litesprite. For her, it is convenient. It feels like a real game, and it helps calm her down and stay grounded, something she struggles to do. We strategically focused on establishing the key necessary market and clinical validation to drive adoption with our key buyers. Along the way, we also realized revenue. With the support of all these partners, we have laid the foundation for a business with long-term sustainable growth that is ready for acceleration. Our trajectory fits how the best digital health companies grow. This foundation includes our clinical results. It is the reason why we have won over 20 Global Health Innovation Awards. Our clinical improvement of a 2.5 reduction in the PHQ-8 translates into a person going into work 2 more days each week versus staying in bed. When Litesprite is used as an adjunct to therapy, it has the same scale improvement as a pharmacologic. Our independent health economic study is the necessary ROI evidence to encourage high provider adoption. Our clinical results generate sizable revenue opportunities. But clinical results don't matter if people don't use it. We have built a technology that solves mental health issues and that people love. Our thousands of players have already completed over 9,000 sessions. We have retention rates 3x above the industry average and 2x above the leading consumer product. With the pandemic, we have seen robust consumer demand and launched a D2C subscription. We also started receiving inbound requests from employers and launched sales activities to accelerate adoption in this channel. We were also invited to be part of Mercer Consulting's new vendor database. We started outreach efforts with payers early on. Their future growth will come through the Medicaid line of business via performance-based contracts or capitated models. We have established acceptance with these patients. These are high cost and difficult to motivate individuals that often have complex issues. And they have said Litesprite is life-changing. They're inspiration every morning, and they are ready for the next level. We are accelerating these conversations and continuing our outreach efforts with the support of strategic partners like Bayer. We are initially targeting an ICP worth $15 million. The current revenue multiples in the digital health sector are 20 to 40x. We are proud of our strategic investments by Bayer AG, Symphonia RX, Jumpstart Foundry, and now Nex Cubed. We are leaders in the new field of healthcare entertainment. We wrote Nike's first wearable technology patents, managed the largest portfolio of mobile apps for the Department of Defense, managed data science teams for the State Department, and built consumer-facing experiences for global brands such as Disney and American Greetings. We are looking to expand our team and need marketing, sales, and operations people to help us meet our next milestones. We are also looking for introductions to employers and payers who could use our solutions. Litesprite gets people engaged. Engaged people get better faster. Thank you.
We are proud to present Care Coach. Victor has created a digital avatar that has leveraged the power of AI and human connection to build strong relationships with complex patients, coach risk mitigating behaviors, and help coordinate care. His platform has saved providers millions of dollars in cost avoidance and has improved patient outcomes along the way. Take it away, Victor.
At MIT, I was working on a clinical trial for NASA's Space Telerobotics program when I realized that while I was growing up in Canada, my grandmother was living by herself in Taiwan, becoming very lonely. She needed a telecompanion. So, since it was challenging enough for my mom to get her set up for the occasional Skype call, I built for them the Care.Coach avatar to solve senior loneliness.
I needed a lot of help sometimes.
Bill Langlois is not as mobile as he used to be, and when his wife is away, his only companions are his cats, Boots, Sneakers, and Socks.
Hello, Socks.
Obviously, one of these is not like the others.
Because she's my friend. I talk to her like I talk to my family.
Socks is a healthcare avatar.
She calms me down, especially if I can't breathe. I used to panic. Now she walks me through it.
Whenever the avatar is awake,
So if I want to wake Buddy the dog up, I'm just going to pat him on the head.
that means the camera is turned on, and a health advocate employed by Care.Coach can see and interact with its users.
And it's going to make sure that they take their medications, that they come to their medical appointments, that they participate in their rehab, that they open the door for our nursing staff.
Can you tell me what kinds of things you do to help Bill out?
Oh, when he is in pain, I call for help.
Socks even entertains.
Help me look for the items as I call them.
It's peace of mind for his whole family.
Well, I'm like not nervous like I used to be.
It may sound silly to you. This thing works. And she brought me out of complete depression when I'm alone. Between my wife and her, I got it made.
Imagine a future in which technology has made intelligent, empathetic conversation not scarce and expensive, but abundant and scalable. How would that impact healthcare? Care.Coach delivers this future today. As of this moment, we're supporting hundreds of individuals like Bill, who together account for $20 million per year in medical expenses. We build powerful relationships with these most complex, high-risk members of the healthcare system, supporting and coaching them day to day to live their best lives and to maximize their independence. University of Washington, Stanford University, and others have published clinical research showing that the Care.Coach avatar indeed reduces loneliness and depression. And succeeding in solving senior loneliness made us realize an even greater mission. It turns out this ability to build personal relationships with medically and psychosocially complex individuals is the critical missing link in the healthcare system's ability to drive healthcare outcomes and to control costs, especially among the top 5% highest need, highest risk population who account for 50% of all healthcare costs. So we built an expert system into which we coded thousands of clinical coaching protocols for common chronic conditions and other risk factors, delivering this coaching on the foundation of our powerful relationships built through our avatars. We found that our health plan customers were able to reduce the amount of home care services required and the frequency of emergency department visits because their members were supported to take care of themselves better. Our current PACE and Medicare Advantage health plan customers together insure well over 20 million lives, and we did 7 figures in revenues last year. The relationships our avatars have built have also produced tens of millions of conversational data points. And for understanding the truly natural responses of an older adult population, we've achieved conversational AI performance measures that surpass Google. We are already profitable, and in the next year, our AI pipeline will halve our cost of goods sold. COVID has accelerated our sales cycles, helping us to launch 5 new health plan customers in only 3 months. In addition to COVID protocols for self-isolation delivered through our avatar, we've recently launched a new product, Care.Coach Video Visits, which greatly expands the reach of telemedicine to individuals who are self-isolating and don't have the tech skills to take advantage of mass consumer telemedicine.
Have you taken your morning medications yet?
No, it's giving me a rash. I don't want to take it.
Oh, I'm sorry to hear that. I'll let your provider know so they can help you out. Please excuse me for a moment. Good news. I talked to your provider and your doctor will call you now.
Oh, good. Thanks, buddy.
Annie, it's Dr. Freeman. I got a call from your avatar about your concern with your medication.
We've already raised $8 million in public and private funding, and we'll be raising a Series A to advance our go-to-market and our AI platform. If you're interested in joining us to scale human touch, please get in touch.
We are in the midst of a global healthcare crisis. Only healthcare companies will be able to solve this problem. The old healthcare solutions are not going to solve this issue, however. If they could, they would have done so already. A CB Insights survey recently of healthcare executives found that 88% of respondents agreed that digital health technologies will take us out of this pandemic. Only 12% of respondents believed that therapeutics would solve the current global pandemic. But software is now creating therapeutics too. To the investors in the audience who do not have exposure to this space, this is probably the last best time to begin building your portfolio. To those with established positions, this is likely your last best time to double down on your portfolio and your investment thesis here. Nex Cubed Digital Health is comprised of a team of nearly 20 healthcare subject matter experts, including the former number 2 at the FDA, the former VP of Digital Health at Stanford, a physician turned C-suite executive at one of the largest care delivery systems in the country, a pharmacist turned successful entrepreneur, the special advisor for healthcare policy at Panasonic, the EVP at HMS, and numerous other former and current executives at some of the most consequential strategic and startup companies in healthcare. We at Nex Cubed believe that we're identifying the next great companies in healthcare, the type of companies that can take us out of this pandemic, the type of companies that represent the future of healthcare. I invite all of you to join us on the live Zoom webinar to hear more from these amazing founders and learn more about Nex Cubed Digital Healthcare and the investors that we're supporting. Thank you.
Thanks, Daniel, for your eloquent summary. I really appreciate it, and I hope the audience did as well. As a reminder, we're going to be transitioning over to our live Zoom webinar to where you can hear from these amazing founders and learn more about their products, their team, and their business. I look forward to seeing you there.